Welcome to this fascinating, groundbreaking educational video from Health Equals Wellness, where we discover the complexities and nuances of a medical marvel of robots performing one of the most complex and delicate surgeries. Chapter 1. The New Way of Heart Transplants. Imagine a heart transplant without opening the chest. Sounds impossible, right? Well, not anymore. The world's first fully robotic heart transplant was performed at King Faisal Specialist Hospital and Research Center, KFSHRC, in Saudi Arabia. This revolutionary procedure, conducted on a 16-year-old patient with end-stage heart failure, marks a pivotal moment in medical history. Led by Dr. Faris Khaliel, a team of skilled surgeons at KFSHRC in Saudi Arabia turned this seemingly far-fetched idea into reality. The procedure took just 2.5 hours, a fraction of the time typically required for traditional heart transplants. But what's truly astounding is the preparation that went into this groundbreaking surgery. Dr. Khaliel and his team spent weeks meticulously planning every detail. They even practiced the entire procedure 7 times in virtual reality over 3 days. Robotic surgery isn't entirely new, but this is the first time a full heart transplant was completed entirely by robotic arms. Every incision, every suture, and every vital step was performed by robotic arms with unparalleled precision. Chapter 2. Redefining Cardiac Care. This isn't just about one successful surgery. It's about revolutionizing cardiac care worldwide. Cardiovascular disease is the leading cause of death worldwide, with over 17 million people dying each year, and heart transplants are the last resort for most patients. Traditional heart transplants often require lengthy recovery periods, sometimes stretching into months. Heart transplants have a high risk of complications, and patients normally struggle with basic daily activities. Robotic surgery is a more minimally invasive approach that comes with many benefits. Let's look at 4 of those benefits. Number 1 is reduced pain. Robotic surgery is often done by using small incisions, where the robot surgeon operates with miniaturized instruments. In contrast, traditional surgery requires larger incisions and involve more trauma to the surrounding tissue and nerves, which cause an inflammatory response, which contributes to more pain. Benefit number 2 is shorter recovery time. Patients who undergo robotic surgeries often spend less time in the hospital and recover more quickly at home. Benefit number 3, reduced risk of complications. Due to the precision of robotic surgery, minimizing the risk of infections, excessive blood loss, and other surgical complications. Benefit number 4 focuses on the human surgeon. The robotic arms can move with more stability and precision than a human hand, which reduces the need for surgeons to make repetitive or physically strenuous movements, lessening fatigue over time. In many cases, robotic surgery can lead to shorter operating time, which means the surgeon is less likely to become exhausted during the procedure. Chapter 3. Benefits that go beyond the operating room. The impact of robotic surgery extends far beyond the operating table. Studies have shown that robotic procedures can lead to shorter hospital stays and lower the need for blood transfusions, which will potentially reduce healthcare costs in the long run. The success of this procedure opens up a world of possibilities. Robotic surgery is already making waves in various medical fields, from urology to gynecology. Now, with this breakthrough in cardiac surgery, we're witnessing the dawn of a new era in healthcare. Experts predict that robotic surgery will become increasingly mainstream, offering minimally invasive options across various medical specialties. We're looking at a future where surgical precision is enhanced by advanced robotics and 3D imaging. In the future, robotic surgery could be done allowing surgeons to operate on patients thousands of miles away. The surgeon in one country and the patient in another can be connected by telemedicine and telerobotic surgery platforms. Right now, robots assist in surgeries like knee replacements and gallbladder removals. But with advances like this heart transplant, the potential is endless. Brain surgeries, organ transplants, and even cancer removal could all be perfected with robotic technology. The initial cost of robotic systems can be substantial, and there's a steep learning curve for surgeons. However, as technology advances and more surgeons gain expertise, these hurdles are likely to diminish. Chapter number 4. Robotic surgery will have a global impact. King Faisal Specialist Hospital and Research Center's achievement isn't just a win for Saudi Arabia, it's a leap forward for global healthcare. As a leading training center for robotic organ transplant surgeries, KFSHRC is collaborating with medical institutions worldwide to advance the understanding and practice of minimally invasive organ transplants. Just imagine how this could help developing nations, where access to highly skilled surgeons is limited. With remote robotic surgery, world-class medical care can be delivered anywhere. The world's first fully robotic heart transplant isn't just a medical breakthrough. It's a testament to human ingenuity and the pursuit of better healthcare in this new artificial intelligence world. As we look to the horizon, it is clear. The beating heart of medical innovation is stronger than ever, and the pulse of progress is quickening. Thank you for joining us on this exciting journey through the cutting edge of medical science. If you gained insight from this video, please like, subscribe, and share this video to spread the word about this incredible advancement in healthcare. Until next time, keep your hearts healthy and your minds refreshed to the amazing possibilities of medical innovation.
Before we begin, this video is not intended as a substitute for a professional medical diagnosis. If you or someone you know is experiencing mental health issues, please consult a licensed mental health professional. This video will be looking at two often confused mental health conditions, bipolar disorder and borderline personality disorder, or BPD. We will look at the similarities and differences between bipolar disorder and borderline personality disorder. While these two conditions may seem similar on the surface, they are quite different. We are going to take a look at the nature of the disorders, mood changes, behavioral patterns, triggers, symptom duration, and treatment options. Stick around to the end to get a full understanding of both disorders and treatment options available. Chapter 1. The nature of the disorders. Bipolar disorder is a mood disorder characterized by extreme shifts in mood, energy, and activity levels. This includes highs, known as mania or hypomania, where the person with bipolar disorder feels euphoric and full of energy. These can be followed by depressive episodes, where they feel intense sadness or fatigue. On the other hand, borderline personality disorder, or BPD, is a personality disorder marked by instability in relationships, self-image, and emotions. People with BPD often struggle with intense emotional reactions and have a fear of abandonment, which can lead to impulsive behavior. Chapter 2. Mood changes. In bipolar disorder, mood swings are distinct and happen in phases. Manic or depressive episodes can last for weeks or even months. During mania, a person may feel euphoric by having an exaggerated sense of happiness or invincibility, be overly energetic with less than normal sleeping patterns, be impulsive by engaging in risky behaviors like spending sprees, reckless driving, or make decisions without considering the consequences. A person with bipolar may also be easily distracted by jumping quickly between ideas or conversations while continually talking at a rapid rate. During the depressive phase, the same person may have feelings of worthlessness or guilt, and have low energy, making daily activities exhausting or overwhelming. They might avoid social interactions or lose interest in activities they usually enjoy. Sleep disturbances, either insomnia or excessive sleeping, are common. With BPD, mood shifts are typically intense and can happen very quickly. A person may start the day feeling emotionally stable, however, in that same day, if a friend or partner doesn't reply to a text message right away or seems distant, the person with BPD might quickly change to feelings of intense anger, fear of abandonment, or emotional distress. That could swiftly change to feelings of sadness or emptiness, leading to self-destructive behaviors, like impulsively breaking off the relationship. That can then quickly change to feelings of regret or guilt, seeking to reconcile. This cycle is likely to repeat in the future. Imagine bipolar moods as seasons, while BPD moods are more like unpredictable changing weather. Or think of bipolar as a marathon, while BPD is more like a series of sprints. Chapter 3. Triggers. Mood shifts in bipolar disorder are less dependent on immediate external events, and more driven by internal, biological factors based on the brain's internal mood regulation, with manic or depressive episodes lasting days, weeks, or months. Stressful life events like a job loss, financial problems, or the death of a loved one can trigger an episode. Sleep disturbances can also trigger manic or depressive episodes that can last for weeks or months if untreated. Substance use of alcohol, drugs, or certain medications can exacerbate mood swings or trigger an episode. Seasonal changes also come into play as a trigger. Some people with bipolar disorder experience more depressive episodes in the winter and more manic episodes in the summer. In contrast, BPD mood shifts in BPD are highly sensitive to external, interpersonal events and tend to occur in response to perceived threats, especially regarding relationships. These include fear of abandonment, real or perceived, can trigger intense emotional reactions. Conflict in relationships, even minor disagreements, can lead to rapid mood shifts. These can escalate from feeling calm to feeling rage, sadness, or emptiness in a matter of minutes or hours. A person with BPD can have a fragile sense of self-worth, which can lead to mood shifts. For example, feelings of inadequacy or shame after a minor failure or criticism can lead to sudden emotional turmoil. In BPD, a person's emotional system is very sensitive and reactive, allowing small events to lead to intense emotional shifts. Chapter 4. Treatment options. Both conditions benefit from professional help, but treatment approaches differ. Bipolar disorder requires a combination of medication, therapy, and lifestyle management. The goal is to stabilize mood swings, manage symptoms, and help the individual live a balanced life. Medications are typically the cornerstone of bipolar disorder treatment and are aimed at stabilizing mood and preventing episodes of mania and depression. They include mood stabilizers like lithium, valproic acid known as depakine, or carbamazepine known as Tegretol. Medications can also include antipsychotics like quetiapine known as Seroquel, lurasidone known as Latuda, or aripiprazole known as Abilify. Benzodiazepines can also be prescribed as a short-term treatment for anxiety or anxiety of insomnia. Therapy is essential for managing symptoms, understanding the illness, and improving relationships and coping skills. 4 common therapy types are cognitive behavioral therapy, CBT, which helps individuals recognize negative thought patterns. Interpersonal social rhythm therapy, IPSRT, to help maintain regular daily routines like making the bed in the morning. Family therapy is important to improve communication within the family and psychoeducation, educating the person and their family about the disorder. The third component in bipolar treatment is lifestyle changes. They include maintaining a consistent sleep schedule, exercise especially for depression, avoiding drugs and alcohol, and tracking mood changes to help identify triggers. BPD treatment focuses more on therapy than medication, although can also include medication, group therapy, and self-care and coping strategies. The goal is to improve emotional regulation, interpersonal relationships, and self-image through structured therapeutic interventions. They include dialectical behavior therapy, DBT, to help teach skills like emotional regulation, distress tolerance, mindfulness, and interpersonal effectiveness. Cognitive behavioral therapy, CBT, which helps individuals recognize and change distorted thinking patterns. Mentalization-based therapy, MBT, which helps individuals better understand their emotions and thoughts. Schema-focused therapy, which focuses on identifying and changing deeply rooted patterns. And transference-focused psychotherapy, TFP, focusing on understanding emotional reactions and relationships. Medications can commonly include antidepressants or SSRIs to help with mood stabilization and depressive symptoms. Mood stabilizers to help regulate mood swings and impulsivity, or antipsychotics to manage symptoms of anger, paranoia, or severe emotional dysregulation. Group therapy allows the individual to work on interpersonal skills in a supportive environment. Finally, self-care and coping strategies that include mindfulness practices to help individuals stay grounded and regulate emotions. Developing healthy boundaries is important in relationships to avoid emotional dysregulation. And finally, managing impulsivity to help control impulsive behaviors and decision-making. Remember, proper diagnosis is crucial for effective treatment. If you're experiencing symptoms, consult a mental health professional for an accurate assessment. While bipolar disorder and BPD share some similarities, understanding their differences is key to getting the right help. If you found this video helpful, give it a thumbs up and subscribe for more mental health content from Health Equals Wellness. Take care of yourselves, and we'll see you in the next video.
Have you ever wondered why some people willingly step into a cold shower every morning? It might sound crazy, but there's a growing trend around cold showers. A number of highly successful people have incorporated cold showers into their morning rituals. Make sure you stay to the end to find out what famous people, celebrities, and successful people include cold showers into their morning routine. You might be inspired. In this video, we will be uncovering 7 unexpected health benefits that might convince you to turn that hot water knob down. The benefits might surprise you. Benefit number 1, immunity boost. Showers can bolster your immunity. Recent studies found that people who took cold showers were less likely to call in sick. Regular exposure to cold water can stimulate the production of white blood cells, which are crucial components of the immune system. Repeated cold water immersions can lead to a significant increase in the number of monocytes and lymphocytes, which are types of white blood cells that play a role in immune response. Additionally, cold showers or baths may increase the production of certain cytokines, such as interleukin-6, IL-6, which are involved in the body's inflammatory response and help in fighting infections. The shock of cold water also increases the metabolic rate and the release of catecholamines, which can further activate the immune system. While the direct causal relationship between cold showers and enhanced immunity requires more research, these physiological responses suggest a potential benefit in terms of reducing susceptibility to illnesses. Benefit number 2, enhances mood. Feeling down? Taking cold showers can significantly enhance your mood by triggering the release of endorphins, often referred to as happiness hormones. The shock of cold water stimulates the sympathetic nervous system, leading to an increase in cortisol and adrenaline levels, which can elevate alertness and energy. The invigorating experience of a cold shower can serve as a form of mild electroshock therapy, jolting the body into a heightened state of awareness and positivity, making it an effective tool for boosting mood and resilience against daily stressors. Benefit number 3, improved circulation. Cold showers can significantly improve circulation in the body by triggering a physiological response that enhances blood flow. When cold water hits the skin, it causes the blood vessels on the surface to constrict, a process known as vasoconstriction. This constriction forces blood away from the skin's surface and towards the core of the body, where vital organs are located. As a result, blood vessels in deeper tissues dilate or widen to accommodate the increased blood flow, thereby improving circulation in these areas. Over time, regular exposure to cold showers can make the circulatory system more efficient, potentially benefiting individuals with conditions like poor circulation, high blood pressure, and diabetes. Benefit number 4, increased metabolism. Taking cold showers can increase metabolism by prompting the body to expend additional energy to maintain its core temperature. When exposed to cold water, the body activates its thermogenic processes to generate heat, thereby increasing metabolic rate. This process involves the activation of brown adipose tissue, which burns calories to produce heat, contributing to a higher overall energy expenditure. A study found that cold water immersion at 57 degrees Fahrenheit could increase metabolism by as much as 350%. Benefit number 5, reduces muscle soreness. Athletes swear by cold showers for reducing muscle soreness after intense workouts. Cold showers are effective in reducing muscle soreness, known as DOMS. When cold water is applied to the body, it causes blood vessels to constrict, which helps reduce swelling and inflammation in the muscles. This process can help decrease the discomfort associated with muscle soreness and expedite recovery, allowing individuals to perform better in subsequent workouts or competitions. Cold showers or ice baths serve as a practical and accessible method for athletes and fitness enthusiasts to manage muscle soreness and enhance recovery. Benefit number 6, promotes healthy skin and hair. For those of you into skincare, cold showers can give your skin and hair a healthy glow by tightening the pores and preventing the loss of natural oils. Unlike hot water, which can strip the skin and hair of essential oils, cold water helps maintain these oils, leading to a more hydrated and less irritated complexion. Cold showers cause blood vessels to constrict, which boosts circulation as the body works to maintain its core temperature. This increased blood flow delivers more oxygen and nutrients to the skin and scalp, providing a healthier appearance. Last up, benefit 7, enhanced mental clarity. Many high achievers, including Elon Musk, swear by cold showers for boosting mental clarity and productivity. Elon Musk takes cold showers in the morning as part of his daily routine. He reportedly wakes up early and starts his day with an extreme cold shower to shock his body and prepare for the busy day ahead. Musk has mentioned that cold showering is a non-negotiable habit for him, even prioritizing it over breakfast to ensure he gets the most out of his morning routine. Other famous achievers who incorporate cold showers into their morning routines to boost alertness and mental clarity include Arnold Schwarzenegger, Lady Gaga, Tony Robbins, Dwayne "The Rock" Johnson, Jack Dorsey, Lizzo, and Joe Rogan. The shock of cold water can enhance your focus and mental clarity by stimulating the body's nervous system and increasing blood flow to the brain. The sudden exposure to cold water activates the sympathetic nervous system, leading to the release of neurotransmitters such as norepinephrine and dopamine, which are known to improve focus and alertness. There we have it. 7 compelling reasons to brave the cold and start incorporating cold showers into your routine. Whether you're looking to boost your health, mood, or productivity, it might just be worth the goosebumps. If you found this video helpful or educational, give us a thumbs up and subscribe for more Health Equals Wellness tips. Let us know in the comments if you were brave enough to try cold showers and what benefits you experience. Until next time, stay cool!
Welcome back to our channel. Today we're diving into one of the most talked about diets of the year, the carnivore diet. If you've been curious about what it is, how it works, and whether it's the right fit for you, stick around. We've got all the meaty and juicy details. What is the carnivore diet? The carnivore diet is exactly what it sounds like. A diet where you eat only animal products. This means your meals are filled with meats, fish, eggs, and some dairy. No veggies, no fruits, no grains. It's an extreme elimination diet that has gained a lot of attention recently. Always consult with your healthcare professional before starting or modifying any diet, especially one as restrictive as the carnivore diet. Listen to your body and pay attention to how you feel throughout each stage and make adjustments as needed. Let's start with what you can eat on this diet. Here are the staples grouped into categories: beef, pork, lamb, and poultry. Fish and seafood like prawns, mussels, shrimp, and other shellfish. Eggs and dairy products like cheese and butter, if tolerated. How does the carnivore diet actually work? It drastically reduces your carbohydrate intake, which means your body shifts from using carbs for energy to using fats. This state is called ketosis. You might be familiar with it if you've heard of the ketogenic diet. In ketosis, your body becomes incredibly efficient at burning fat for fuel. There are typically 4 stages that allow the body to adapt gradually to the new way of eating, potentially reducing side effects and increasing the chances of long-term success. Stage 1, transition phase, normally with a duration rate of 1 to 2 weeks. The objective is to gradually reduce carbohydrate intake and increase animal-based foods. Start by cutting out sources of carbohydrates like bread, pasta, and sugar. Increase your intake of animal products such as meat, fish, eggs, and dairy. You can include low-carb vegetables if desired, but start to reduce their quantity. Stage 2, adaptation phase, normally with a duration rate of 3 to 4 weeks. The objective is to fully transition to a carnivore diet while allowing the body to adapt to ketosis. Eliminate all plant-based foods focusing solely on animal products. Include organ meats for added nutrients. Drink plenty of water and consider adding electrolytes to avoid symptoms of the keto flu, such as headaches, fatigue, and irritability. Stage 3, maintenance phase, normally up to 3 months or more. The objective is to maintain the carnivore diet, monitor health markers, and assess personal well-being. Stick to a strict animal-based diet and pay close attention to how your body feels and any changes in health markers like weight, energy levels, and digestion. Adjust food choices based on how your body responds, ensuring you get a variety of nutrients from different animal sources, including organ meats. Stage 4, personalization phase, normally after 3 months. The objective is to customize your diet based on individual needs and health goals. Some individuals may reintroduce certain low-carb vegetables or fruits to see how your body reacts. Decide if you want to continue a strict carnivore approach or a more flexible version that includes a few plant-based foods. Effects on weight loss. Many followers of the carnivore diet report rapid weight loss. This is because you're eliminating carbs, which reduces water retention, and you're likely eating fewer calories because protein and fat are very satiating. However, it's important to remember that while initial weight loss can be fast, it might plateau over time as your body adjusts. Potential benefits. There are several potential benefits to the carnivore diet beyond weight loss. Those include improved mental clarity, sharpness, focus, and concentration. Reduced inflammation and joint pain. Stabilized blood sugar levels can be great for people with diabetes. Some people also find that their digestion improves, especially if they are sensitive to plant-based foods. Potential drawbacks and long-term health effects. There are some potential drawbacks and concerns, especially regarding long-term health. First up is nutrient deficiencies. By excluding plant-based foods, you might miss out on essential vitamins and minerals like vitamin C, magnesium, and fiber. Digestive issues. The lack of dietary fiber can lead to constipation and other digestive problems over time. Cholesterol levels. Consuming high amounts of saturated fats could raise your LDL cholesterol, which is a risk factor for heart disease. Experts also warn about the potential for increased risk of certain cancers due to high red meat consumption, though this is still a topic of ongoing research. How long should you stay on this diet? This varies from person to person. Some people use it as a short-term reset, staying on it for a few weeks to a few months. Others choose to follow it longer. However, it's crucial to listen to your body and consult with a healthcare professional before making any drastic dietary changes, both short and long-term. Is it for you? It can be effective for certain individuals, particularly those with specific health conditions or those looking for a reset. However, it's not for everyone, and the long-term effects are still not well understood. If you're considering this diet, weigh the pros and cons, and think about your own health needs and goals. And always remember, consult with your healthcare provider, and balance and moderation are key. If you found the information in this video helpful, give it a thumbs up and subscribe to Health Equals Wellness for more health and diet tips.
Welcome to the future of healthcare, where artificial intelligence and robotics are revolutionizing the way we care for patients. Artificial intelligence and robotics are not just the stuff of science fiction anymore. They're here, and they're transforming healthcare in ways we never thought possible. From surgical assistance to rehabilitation, AI-driven robots are making a massive impact. Let's explore the different areas where these technologies are making a real difference to patients' healthcare journey. First up, surgical assistance. Robotic surgery is one of the most well-known applications of AI in healthcare. Robotics and AI assist surgeons in performing delicate procedures with precision, reducing recovery times and improving surgical outcomes. AI and robotics are not just tools, they are partners in the operating room. Robots like the Da Vinci surgical system allow surgeons to perform complex procedures with more precision, flexibility, and control than traditional techniques. With AI integration, these systems can even analyze data from previous surgeries to provide real-time insights and suggestions, making surgeries safer and more efficient. Next, we have rehabilitation and physical therapy. In rehabilitation and elderly care, robots offer support for physical therapy and daily activities, helping patients regain independence. They also provide companionship, reducing loneliness among the elderly and improving their quality of life. Social robots like Pepper and Paro can interact with patients and provide companionship while monitoring their health. AI-powered robotic exoskeletons help patients regain mobility after injuries or strokes. These devices provide personalized therapy by adapting to each patient's needs and progress, making recovery faster and more effective. AI algorithms continuously learn and adjust the therapy, providing optimal support and challenge for the patient, ultimately leading to better outcomes. These robots can remind patients to take their medication, help with meals and exercise, and keep track of their vital signs. Now let's look at logistics and supply chain management. Logistics and supply chain management in hospitals can be incredibly complex. Robots handle tasks such as delivering supplies, assisting staff, and conducting routine checkups. AI algorithms can analyze historical data, seasonal trends, and external factors to accurately predict future demand for medical supplies and pharmaceuticals. This helps healthcare providers maintain optimal inventory levels for both shortages and overstock situations. AI and blockchain technology can work together to provide enhanced traceability and transparency in the healthcare supply chain. This ensures that all steps of the supply chain are recorded and can be audited, reducing the risk of counterfeit products and ensuring the authenticity and safety of medical supplies. Efficient logistics and supply chain management directly impact patient care. Robots and AI are taking a much bigger role. By ensuring that healthcare providers have timely access to necessary supplies and medications, AI and robotics help prevent treatment delays, improve patient outcomes, and enhance the overall efficiency of healthcare delivery systems. Automated systems can also manage the distribution of resources during emergencies, ensuring a rapid and coordinated response. Robots like Tug and Athon are used to transport medications, supplies, and even meals within healthcare facilities. These robots navigate autonomously, reducing the workload on hospital staff and minimizing errors. Let's look at how AI is revolutionizing genomics. By rapidly analyzing genetic data to identify mutations and variations linked to diseases. AI algorithms are being used to analyze medical images such as X-rays, MRIs, and CT scans with greater accuracy and speed than human radiologists. This helps in the early detection of diseases like lung disease, cancer, and neurological disorders earlier and more reliably, leading to timely treatment and better patient outcomes. AI can predict disease outbreaks and the progression of chronic diseases by analyzing large data sets from patient records. This predictive capability allows for more personalized treatment plans and proactive management of patient health. Robotic systems can then assist in performing precise biopsies or other diagnostic procedures. Robotics and AI are streamlining pathology by automating the analysis of tissue samples. AI can detect abnormalities and provide detailed reports, reducing the workload of pathologists and increasing the speed and accuracy of diagnoses. These assistants can suggest possible diagnoses and treatment options, acting as a valuable tool for doctors. AI algorithms are significantly speeding up the process of genome sequencing. By analyzing vast amounts of genetic data faster and more accurately than traditional methods, AI is enabling researchers to decode genomes in a fraction of the time it used to take, paving the way for rapid advancements in personalized medicine. Machine learning models can identify patterns and correlations in genomic data that may not be apparent to human researchers, leading to new insights into genetic disorders, disease risk factors, and potential therapeutic targets. This not only increases efficiency and accuracy, but also allows researchers to handle larger volumes of samples, accelerating the pace of discovery. The future of AI and robotics in healthcare looks incredibly promising. From enhancing the precision of surgeries to providing compassionate patient care, these technologies are set to revolutionize healthcare. If you found this video informative, don't forget to like, share, and subscribe to our channel for more exciting content on the latest in healthcare with Health Equals Wellness. Welcome to our channel. This video explores some lesser-known weight loss tips and tricks that you might not have considered that can help you shed those extra pounds without feeling like you're on a diet. Let's start with the king of weight loss tips: hydration. Start your morning with a glass of warm water. This simple habit can boost your metabolism and help flush out toxins. Add a slice of lemon for an extra detoxifying effect. Drink water before meals. Studies have shown that drinking a glass of water about 30 minutes before you eat can help you feel fuller, which means you can eat less and still feel satisfied. Drinking water can also help reduce cravings for sweet, salty, or savory foods because you might actually be thirsty when you think you're hungry. Staying hydrated helps your body sweat, which helps you exercise longer. It also helps your muscles get the nutrients they need to make energy, which can help build muscle mass. When you're dehydrated, your kidneys retain fluid, which can make it difficult to remove waste such as urine or feces. Aim to drink at least 8 glasses of water a day to stay hydrated and support your weight loss journey. Tip number 2: protein. Protein is incredibly important for weight loss. It can boost your metabolism, reduce your appetite, and help you lose fat. Good protein choices are lean meat, eggs, chicken, Greek yogurt, fish, nuts, and legumes. Protein has a higher thermic effect compared to fats and carbohydrates, meaning your body burns more calories digesting and metabolizing protein. This can help increase your overall calorie expenditure. Protein is essential to preserve muscle mass during weight loss. Consuming adequate protein helps preserve lean muscle tissue, ensuring that the weight you lose comes from fat rather than muscle. Tip number 3: mindful eating. Mindful eating is a game changer. By slowing down and savoring each bite, you give your body time to recognize fullness, which can prevent overeating. Try to eat without distractions like TV or your phone to truly focus on your meal. Mindful eating includes reducing emotional eating. By being more aware of the emotional triggers that lead to eating, mindful eaters can develop healthier ways to cope with stress, boredom, or other emotions without turning to food, which often leads to weight gain. It might sound strange, but using smaller plates can help you eat less. Our brains are wired to feel satisfied when we see a full plate. Trick your brain by filling up a smaller plate. You'll end up eating less without even realizing it. Focusing on the sensory experiences of eating, such as taste, texture, and aroma, can increase satisfaction from smaller portions. This helps reduce the desire to eat more for pleasure. Tip number 4. Quality sleep. Adequate sleep reduces the likelihood of late-night snacking, which is often high in calories and unhealthy foods. When you're well rested, you're less likely to crave sugary or fatty snacks during the night. Quality sleep supports a healthy metabolism. Poor sleep can slow down metabolism, making it harder to burn calories efficiently and leading to weight gain over time. Lack of sleep can increase stress levels, leading to higher cortisol production, which is associated with increased fat storage, especially in the abdominal area. Good sleep helps manage stress and reduces cravings for unhealthy foods. Incorporating good sleep hygiene practices can significantly support weight loss efforts by optimizing hormone balance, reducing unnecessary calorie intake, and enhancing overall well-being. Aim for at least 7 to 8 hours of quality sleep each night. Tip number 5. Accountability and support. Having a support system, such as a workout buddy or a weight loss group, can boost motivation and commitment. Knowing that someone else is monitoring your progress and encouraging you can help keep you focused and driven to achieve your weight loss goals. Regular feedback and encouragement from others can reinforce healthy behaviors and celebrate small victories, making the weight loss journey more enjoyable and less daunting. Positive reinforcement helps build confidence and maintains momentum. Accountability partners or groups can help establish and maintain routines by setting regular check-ins and progress updates. This consistency is key to developing and sticking to healthy habits over the long term. Being part of a supportive community allows for the exchange of useful information, such as new recipes, workout tips, or strategies to overcome challenges. Learning from others' experiences can enhance your own weight loss efforts. Support from others can provide emotional resilience during setbacks or plateaus. Friends, family, or support groups can offer empathy, share their own experiences, and provide strategies to get back on track, preventing discouragement and giving up. Tip number 6. Keep moving daily. This can include rigorous exercise like running, skiing, swimming, biking, or other physical sports you enjoy. However, you don't need to spend hours at the gym. Here are several ways to incorporate weight loss movements within your daily routine. This can include taking the stairs instead of the elevator, walking during breaks, parking farther from your destination, or even going for a stroll in the evening. Activities like cleaning, gardening, mowing the lawn, or even doing laundry can keep you active. These tasks often involve various movements and can burn many calories. If you have a sedentary job, try incorporating simple desk exercises like stretching, leg lifts, or using a stability ball as a chair. Standing desks can also help reduce sitting time. Engaging in playtime with children or pets can be a fun and effective way to stay active. Activities like playing catch, going to the park, or even a simple game of tag can keep you moving. Turn on your favorite music and dance around your house. Dancing is a fun way to get your heart rate up and burn calories without feeling like you're exercising. Integrating these activities into your daily routine can help increase your overall physical activity, contributing to weight loss and better health. Remember, it's all about making small changes that are sustainable. If you found these tips helpful, give this video a thumbs up and share it with your friends. And don't forget to subscribe for more Health Equals Wellness content. Thanks for watching, and I'm sure you will enjoy the next video.
Post-traumatic stress disorder, or PTSD, affects millions worldwide. However, a groundbreaking treatment using MDMA is showing incredible promise. This video from Health Equals Wellness will explore how this therapy works, the science behind it, and the FDA process for approval. We will include real-life testimonials from those who have been a part of the clinical trials and their real-life experiences. Stay until the end to find out who you can contact to where you might be able to get involved in the newly approved clinical trials. Chapter 1. What is MDMA-Assisted Therapy? MDMA-assisted therapy combines the use of MDMA, also known as ecstasy, with psychotherapy sessions. But this isn't about getting high, it's about healing trauma. MDMA affects the brain by releasing neurotransmitters like serotonin, dopamine, and oxytocin. Let's take a look at 7 of those effects that have been documented in MDMA therapy sessions. Number 1. Enhanced feelings of empathy and emotional openness, emotional warmth, and closeness to others. This helps patients connect more deeply with their therapists and their own emotions. Number 2. Reduced fear and anxiety. MDMA reduces activity in the amygdala, the brain's fear center, allowing patients to revisit traumatic memories with less anxiety and emotional distress. Number 3. Enhanced mood and well-being. Patients often experience elevated mood, happiness, and a sense of relaxation, both physically and mentally. Number 4. Heightened openness and extroversion. The drug promotes a state of increased openness and sociability, which can help patients communicate more freely during therapy sessions. Number 5. Anxiolysis or reduced anxiety. MDMA creates a sense of detachment from immediate threats, allowing patients to reflect on past experiences from different emotional perspectives. Number 6. Increased trust and bonding. MDMA boosts oxytocin levels, promoting feelings of trust and bonding, which can strengthen the therapeutic alliance. Number 7. Altered perception. Patients may experience slight changes in visual, auditory, and tactile perception, which can contribute to a shift in perspective. This unique combination of effects creates an optimal state for fear extinction and memory reconsolidation, allowing patients to process traumatic memories and experiences in a new way, potentially leading to significant therapeutic breakthroughs. Chapter 2. The therapy process. The treatment typically involves 3 main phases. First, the preparatory sessions. Starting with multiple preparatory sessions, usually 3 90-minute sessions without MDMA, aiming to build trust between patient and therapist. This sets treatment goals and expectations while educating the patient about the therapy process. The second phase involves 2 to 3 6 to 8 hour sessions, spaced about a month apart, conducted in a controlled clinical setting with 2 trained therapists present. Patients ingest a carefully measured dose of MDMA, typically 120 mg with an optional 40 mg booster, while in an environment designed to be calm and comfortable. Then the therapists guide the process by encouraging the exploration of emotions and thoughts. Stage 3 is the integration phase. It involves several 90-minute integration sessions following each MDMA session, which helps patients process and make sense of their experiences. It focuses on applying insights gained to daily life, which aims to consolidate the therapeutic benefits. It's important to note that while recreational use of MDMA can have negative effects on the brain, controlled use in a therapeutic setting appears to have different outcomes. This structured approach combines traditional psychotherapy techniques with the unique effects of MDMA to create an environment conducive to processing traumatic memories and emotions. The science behind it. Chapter 3. The science behind MDMA works on multiple levels in the brain. It reduces activity in the amygdala, our fear center. It increases activity in the prefrontal cortex, involved in processing emotions while boosting levels of oxytocin, the bonding hormone. This unique combination allows patients to revisit traumatic memories while feeling safe and connected. It creates an optimal state for fear extinction and memory reconsolidation. Research suggests that MDMA therapy may lead to lasting changes in brain function, particularly in areas related to fear processing and emotional regulation. The combination of MDMA's neurochemical effects with psychotherapy creates a unique environment for processing traumatic memories and emotions, potentially leading to significant improvements in PTSD symptoms. Chapter 4. Clinical Trial Results, Recent Phase 3. Clinical trials have shown remarkable results. The MAPI-2 clinical trial involved 121 participants, with 104 receiving either MDMA or a placebo combined with extended therapy sessions. 71.2% of participants in the MDMA-assisted therapy group no longer met PTSD criteria after treatment, compared to 47.6% in the placebo group. No other treatment for PTSD has shown this level of efficacy in such a short time frame. These results suggest that MDMA-assisted therapy is highly effective in treating moderate to severe PTSD, with benefits lasting at least 18 weeks after baseline. The therapy was generally well tolerated, with no serious adverse side effects reported in the MAP2 trial. Chapter 5. Patient Testimonials. This chapter includes 4 testimonials from patients with PTSD who have gone through these clinical trials. Patient number 1. I'd tried everything for my PTSD, but nothing worked. This treatment gave me my life back. Patient 2. It felt like I could finally face my trauma without being paralyzed by fear. The therapists were there, but I was doing the work myself. Patient 3. It wasn't easy, but I could finally process what happened to me. I feel like a different person now. Patient 4. The flashbacks, the nightmares, they're gone. I can enjoy life again. It's like a new chapter in my life. Chapter 6. Looking to the future. On August 9, 2024, the FDA declined to approve Lykos Therapeutics' application for MDMA-assisted therapy, requesting additional research to prove the treatment's safety and effectiveness. While MDMA-assisted therapy isn't yet FDA approved, later that year, in 2024, the FDA granted MDMA breakthrough therapy status, allowing Lykos Therapeutics to provide further proof through additional clinical trials of the treatment's safety and effectiveness to obtain FDA approval. Lykos Therapeutics was previously known as the MAPS Public Benefit Corporation, a for-profit subsidiary of the Multidisciplinary Association for Psychedelic Studies. The company was renamed Lykos Therapeutics in early 2024. Lykos Therapeutics has conducted, to date, 2 Phase 3 clinical trials on MDMA-assisted therapy for PTSD. For millions suffering from PTSD, this treatment offers new hope. It's not just about reducing symptoms, it's about changing the mental health quality of millions of lives permanently. As research continues, MDMA-assisted therapy may revolutionize how we treat PTSD and other mental health conditions. Psychedelic-assisted therapies, particularly with MDMA and psilocybin, show promise for treating conditions like PTSD and treatment-resistant depression. Hope is on the way for millions affected by PTSD. If you found this helpful, don't forget to give it a big thumbs up, share it with your friends who might need this info, and hit that subscribe button to stay updated on FDA approval of MDMA and all our future content from Health Equals Wellness. Thanks for watching, and we'll see you in the next one. The devastating environmental impact of war, what you need to know. War leaves more than destruction in its wake. It doesn't just impact people. Entire ecosystems pay the price. In this video, we'll look through the window to uncover the shocking environmental effects of war that often go unnoticed. As humanity has always counted its war casualties in terms of dead and wounded soldiers and civilians, destroyed cities and livelihoods, the environment is often a hidden victim of war. Over the years, parties to armed conflicts have polluted water, torched crops, cut down forests, poisoned soils, and killed animals to gain military advantage. Environmental degradation and destruction from conflicts not only take a toll on nature itself, but also exacerbate food and water insecurity and destroy livelihoods. Environmental damage threatens the well-being, health, and survival of local populations, increasing their vulnerability for years and even decades. First up, let's talk about pollution. Military vehicles, weapons, and explosives produce harmful pollutants like carbon monoxide, nitrogen oxides, hydrocarbons, and sulfur dioxide. But that's just the beginning. The lasting negative consequences to our Earth's environment is hard to calculate. Artillery strikes, rocket launches, and even landmines release toxic chemicals into the air, soil, and water, wipe out forests, and make farmland unusable. 1 in 6 people around the world have been directly affected this year. From the civil war in Sudan to Russia's war in Ukraine, to the Israel-Hamas war. War doesn't just destroy cities, it destroys entire ecosystems. Habitat loss is a major consequence of armed conflicts. Forests are leveled, and biodiversity plummets as species are driven out or even wiped out entirely. And it's not just a temporary setback. Recovery can take decades if it happens at all. The damage can last far longer than you'd think. The bloody Second World War, Battle of Verdun in France, left the once fertile farmland contaminated. Over a century later, no one can live in the red zone due to the threat of contamination and unexploded bombs. Landmines are deadly devices that linger long after the battles have ended. They not only continue to claim human lives, but they also pose a lethal threat to wildlife. Animals unknowingly wander into these minefields, leading to devastating losses for local ecosystems. Then there's scorched earth tactics. Deliberately setting oil wells on fire or destroying dams is not just about warfare. It's environmental sabotage. These actions create massive pollution, leaving rivers poisoned and skies thick with smoke. The long-term consequences are staggering. These wells can pollute the air for weeks and months, Armed conflicts are also directly tied to deforestation. Forests provide resources for fuel, food, and livelihoods, and their loss exacerbates the hardships faced by local communities. Forests are cut down to fuel war efforts, removing essential ecosystems that are vital for our planet's health. Ukraine has lost 25% of its forest land so far, since the start of the invasion by Russia. Ukraine has not seen its natural reserves suffer this kind of damage in many decades. And it doesn't stop there. Soil degradation is another brutal outcome of war. War has profound and long-lasting effects on soil degradation. Military activities cause direct physical damage to soil structure through bombing and shelling and the movement of heavy vehicles, leading to soil compaction and erosion. Chemical contamination is another significant issue, with heavy metals from weapons, oil spills, and toxic substances like Agent Orange polluting the soil and disrupting its ecology. This not only threatens local agriculture but can trigger food shortages and economic instability. One heartbreaking statistic: a 2018 study published in Nature revealed that even a single year of conflict can cause local wildlife populations to crash. The loss of wildlife is an underreported consequence of war, but the impact is massive, pushing species closer to extinction. Armed conflicts often lead to dramatic declines in wildlife populations, with some species being pushed to the brink of extinction. For example, during the Sudanese Civil War, South Sudan's elephant population plummeted from 100,000 to just 5,000. The destruction of protected areas and national parks further exacerbates the problem, as seen in Mozambique, where giraffe and elephant herds in Gorongosa National Park shrank by 90% during the Civil War. But perhaps the most catastrophic environmental threat comes from the production, testing, and use of biological, chemical, and nuclear weapons. Biological, chemical, and nuclear weapons have devastating and far-reaching effects during war, causing immense human suffering and long-term environmental damage. Biological weapons, such as anthrax or smallpox, can spread rapidly, leading to widespread disease outbreaks that overwhelm healthcare systems and potentially cause pandemics. Chemical weapons, like nerve agents and mustard gas, inflict immediate and severe damage to the respiratory tract, skin, and eyes, with long-term effects including cancers and damage to various body systems. Nuclear weapons are particularly catastrophic, causing massive death and destruction through blast waves, intense heat, and radiation. Their use can lead to long-term environmental contamination, food shortages, and global climate effects. Beyond the initial destruction, the bombs release significant amounts of radiation into the environment, contaminating soil, water, and vegetation. The explosions also altered the genetic material of surviving plants and animals, disrupting local ecosystems. Even decades after the bombings, some areas still showed signs of radioactive contamination, affecting the environment and human health across generations. Sometimes, we only look at the human cost of war, which can't be understated. But we also all live with the environmental devastation that follows, which should be part of the human cost calculation. From pollution and habitat loss to the larger climate crisis that affects generations, conflict takes a toll on the planet we all share. We still have the power to raise awareness, advocate for change, and push for solutions that protect both people and our environment. If you found this video eye-opening, don't forget to like and subscribe. Let's work together to spread awareness and drive positive change. If you have ideas of how people can get involved, to have a voice in preventing future conflicts or resources to help our environment, please put them in the comments below. Thanks for watching. Did you know that you're not walking around with the same skeleton you were born with? Your bones are in a constant state of change. Every 10 years, your skeleton practically renews itself. But how does that even happen? Stick around to learn the science behind how your bones are rebuilt all the time and why that matters for your health and longevity, and how AI is playing a role in future bone and joint health. We will also look at how you can support the bones that support you. Chapter 1. Bone composition. Bones are living tissues that constantly undergo growth and repair throughout a person's life. They provide structural support for the body, protect vital organs, and serve as sites for blood cell production. Bones are composed of collagen, calcium, and phosphorus. Calcium and phosphorus are minerals that make bones strong and rigid, whereas collagen is a protein that gives bones flexibility. Bone growth begins in early fetal development and continues into adulthood. However, not all bone growth is the same. Long bones like the femur grows with a process called endochondral ossification. Cartilage serves as a template, and osteoblasts replace it with bone tissue. Flat bones like the skull use a different process called intramembranous ossification. The bone develops directly from connective tissue without a cartilage stage in this process. Growth occurs in the growth plates called epiphyseal plates are located at the ends of long bones. These plates produce new cartilage, which is then replaced by bone tissue. The growth plates harden once a person reaches adulthood, and bones stop growing in length. Chapter 2. Your bones are alive. You most likely never thought about it, but your bones are alive. They're not the lifeless, solid structures you might think. Osteoclasts are the demolition crew. Beneath the surface, your bones are buzzing with activity. They break down old bone tissue, a process called resorption. Meanwhile, osteoblasts are like tiny construction workers, building fresh new bone in a process known as formation. These two processes together are called bone remodeling. It doesn't happen all at once. Different bones remodel at different rates. Your bones are working on different schedules to keep your skeleton strong and healthy. Chapter 2. Why bones remodel themselves. Bone remodeling is essential for a few reasons. First, it helps maintain bone strength. Our bones endure stress and strain daily while walking, running, even just sitting. Without regular remodeling, they'd wear down and become fragile. Second, it allows our body to repair minor damages we might not even feel. Every time you stub your toe or twist your ankle, your bones make tiny repairs, and that's all part of the remodeling process. And finally, it helps balance your body's calcium levels. Your bones act like a bank for calcium, releasing it when your body needs it for other functions, like helping your heartbeat or muscles contract. Chapter 3. The 10-year skeleton replacement. Your bones are constantly breaking down and rebuilding, but after about 10 years, you essentially have an entirely new skeleton. The bones in your body right now are less than a decade old. Bone health and growth are essential for overall well-being. But the rate at which this happens varies. For instance, the bones in your arms and legs might remodel faster than your skull or spine. This is because bones under more stress and activity need to be remodeled more frequently to keep up with the demands. Bone density reaches its peak around age 30, after which it can slowly decline. Factors like nutrition, especially calcium and vitamin D, physical activity, weight-bearing exercises, and hormones, like estrogen, affect bone health. Regular bone remodeling helps keep bones strong, but conditions like osteoporosis can weaken bones over time. Chapter 4. How to support healthy bone regrowth. Here are 6 ways to support and stimulate healthy bone regrowth. Number 1. Adequate calcium intake. Calcium is essential for bone formation and maintaining bone density. Make sure to include calcium-rich foods in your diet, such as dairy products, lean meat, cheese, and nuts. Leafy greens like kale and broccoli. Fortified foods, including orange juice and cereals. Adults generally need around 1,000 milligrams of calcium daily, with postmenopausal women and older men needing up to 1,200 milligrams daily. Number 2. Vitamin D for calcium absorption. Vitamin D plays a crucial role in helping the body absorb calcium from the diet. Sunlight exposure is the best natural source, but you can also get vitamin D from fatty fish like salmon and mackerel. Combined with supplements if necessary, adults typically need 600 to 800 international units of vitamin D daily, but those with low levels might require higher doses. Number 3. Regular physical activity, particularly weight-bearing and resistance exercises, stimulates bone formation and helps maintain bone density. Effective exercises include walking, jogging, hiking, weightlifting, resistance training, or climbing stairs. These activities put pressure on bones, encouraging bone tissue remodeling and growth. Number 4. Sufficient protein intake. Protein is a building block of bone tissue. Ensure you're consuming enough protein, as it supports bone regeneration. Including protein-rich foods like salmon, shrimp, poultry, and lean meat are other good sources of protein. Number 5. Avoid excessive alcohol and smoking. Alcohol and smoking can negatively affect bone density and impair the body's ability to rebuild bones. Number 6. Maintaining a healthy body weight. Being underweight or overweight can negatively impact bone health. Maintaining a healthy weight ensures that bones are not overburdened by excessive stress and also reduces the risk of fractures. Chapter 5. AI, Robotic Surgery and the Future of Bone Health. AI-powered robots are bringing unprecedented precision to bone surgeries. Traditional bone surgeries, such as joint replacements or fracture repairs, require extreme accuracy. Even slight deviations in implant placement or bone alignment can lead to complications. These surgeries include joint replacements, spinal surgeries, and bone fracture repairs. Orthopedic surgery is one of the most common areas where robotic systems are having a significant impact. Robots like the Mako system, used in joint replacements, guide surgeons' hands during procedures. These robots work with millimeter precision, ensuring that implants are placed in the exact position for maximum effectiveness and minimal risk of post-operative complications. Thanks for watching. If you enjoyed learning about your ever-changing skeleton, suggestions on keeping your bones strong, and how AI is playing a role in bone health, don't forget to give this video a thumbs up. Subscribe for more cool health and science facts from Health Equals Wellness, and leave a comment below with any questions you might have about your bones. Today we are going to reveal a medical breakthrough in lupus disease. Lupus erythematosus, or SLE, is one of those diseases that's